name is Erin Hockaday. I'm the Environmental Health Director at the Benton-Franklin Health District here in Washington. Some of the conversations we've had on this technical advisory committee have really centered around relationships, and I really think that going forward, that is, one of the biggest challenges that I tend to see in practice is maintaining those connections and relationships with their local health jurisdiction. And that really kind of feeds into one of the challenges that I see, which is just the scope of topics and subject matter knowledge and expertise that you need to have to really tackle environmental health and safety in a school. And they sort of feed into each other, right? Our relationships we have with our local health kind of feeds circularly into the amount of knowledge that you're able to build and maintain at the school level. So when we're out in the field and working with schools, we tend to see either turnover in our staff or turnover in their staff will kind of set us back at square one. And we have to work to kind of rebuild that knowledge base, which is a really, really wide scope of topics when you're talking about schools. So I really hope that the new rules that we're developing will help to bring those two partners together so we can kind of maintain those threads of connections and relationships. That really helps us to maintain that knowledge base in schools. Well, I think there's two sides, right? We're looking at local health and the resources that they need to build their knowledge so that they can ultimately be that resource for our school partners. And that's the ultimate hope, is that the school partners can turn to the local health, no matter what county you're in, and they can be that subject matter expert for the wide range of things that we see in schools. So on the local health side, we really leverage a lot of our counterparts across the state as our resources and partners. Local industry is another thing. I know in Benton-Franklin County, we serve the Tri-Cities kind of metropolitan area. We have a lot of local industry we can lean on. When we were learning to do CTE welding shop inspections, we called the local technical college, and they did us, went and toured us through their facility and taught us about welding and metalworking. But not all counties have those, those local resources. So I hope that we're able to kind of build a more centralized system of resources. Other than that, I'd say, we have ESDs across the state that often, some of them have industrial hygiene resources that schools can reach out to. And I know a lot of local health partners are also working to kind of work in parallel with those ESDs so we can work together to best support schools.